Good afternoon, everybody. Happy Friday. Finally got rid of that rain. We had a nice sunny day out there. A little chilly, but it's going to be a beautiful weekend. So today we're going to talk about COVID numbers. We're going to talk about vaccinations. And of course, we're going to take your questions. So with regard to the numbers, I've been saying this now for several days. The number of new cases is inching up a bit. Yesterday, we reported 37 new cases in the city. The day before that, it was 29 and 35. So our average, 7-day average for new cases reported every day is now 31. As I think you know, it was only a couple of weeks ago that we were down to a 7-day average of 20. So clearly there's a little more virus spreading out there. I know a lot of people are easing up a bit on the mask wearing and on hand washing and social distancing. Now is not the time to do that. We need those numbers to turn back down again. It's a bit of a race between making sure that people use the mitigation procedures, mask wearing, social distancing, and getting vaccines in arms. And we're working very hard to do the latter, and I know that all of you are as well. But please, I really hate to see those numbers edging up. With regard to hospitalizations, there are currently 273 people in the hospital with COVID positive or suspected positive. It's up a tiny bit. Of those 273 people, 75 of those people are in the ICU. In addition, of the people in the ICU, 43 of them are on ventilators. So those are low hospital numbers, but you know that the hospitalizations follow by a week or 10 days after the new cases are reported, until people get very sick. So please stick with the mitigation procedures here. The 7-day average for people admitted to the hospital is now, and these are regional numbers, of course, is now at 35. So those are the COVID numbers. They're still decent, but they're inching up a bit each day. So that concerns us. With regard to vaccinations, so tomorrow and Sunday, the city is doing another mass vaccination event at the America Center, at the Convention Center on Washington, not the Dome, which is around the corner. It is by invitation only. Yesterday, we sent, our health department sent over 12,000 invitations to people that are on our list. We've gotten, 1,000 or more appointments set from that, more than 1,000 appointments set, but we still have appointments available for this Saturday and Sunday. But you have to have an appointment. You can't just show up and get in line. So one of the things that I want to point out to you is that the email, check your spam folder. The email comes from an email address that is contact@ochslife.life. This is the program that we're using. It's through Qualtrics in order to track this registration. And so it's probably not an email address that's in your contact list. So maybe you're not seeing that email. If you still want the vaccine, check your emails. Some folks are also getting contacted via cell phone, if we have your cell phone, and you can click on it there as well. But I think the emails, sometimes we overlook those emails that are not so familiar to us. Now there is at the top of the email a big health department seal, so that you know it's from the city health department, and then there's a message about how you shouldn't share the message, etc. So if you're still wanting the vaccine, you are on our registration list, check your email. We do still have appointments available for Saturday and Sunday. For those of you who have an appointment on Saturday and or Sunday, it should be or Sunday, please be sure to show up for your appointment, and please be sure to show up just, if your appointment's at 10 o'clock, don't come before 9:45. In fact, you can come anytime between 10 and 11. And we're just trying to keep the lines down so that it's more convenient for you. It's at, as I mentioned, it's at America Center, at the Convention Center, which is on Washington there, at about, it's between 8th and 9th on Washington. There's a parking garage right across the street. There's a surface parking lot on 9th Street. Parking will be free. I don't think that'll be too difficult for you. So please show up and make your appointment. I think that's it for vaccinations. You know that next week the state is partnering with our health department to do a vaccination event on Thursday and Friday. That's the 25th and 26th at Forest Park Community College. And that sign up is not yet up. At least it wasn't an hour or two ago by the state. But, you know, we're focusing on this weekend first, which is this Saturday and Sunday at America Center. You need an appointment. For those of you that are on our list that have signed up and still need the vaccine, you can call 657-1499, or you can go to, what's the health department? Health at St. Louis, STLOUIS-mo.gov. First was just health at STLOUIS-mo.gov. So you can sign up either way. Now, the other thing I want to mention, for those of you that are able, we still need volunteers. It takes over 100 people to put on one of these events. We've been using a lot of the same volunteers time after time, and as I mentioned, we've already done 16 of these. Some of them are getting tired. So if you're able to volunteer for non-clinical work, you know, guiding people, handing out forms for people to fill out, just greeting people, giving directions, we'd love to have your help. You can also send an email to health at stlouis-mo.gov for that. And for any of you who are out there who are nurses or doctors who would be willing to work a half a day, we also need vaccinators. And this is going to, you know, we are getting more and more vaccine, and we expect that the amount of vaccine we get is going to continue to go up. But that means we need vaccinators. And so for any of you that are nurses or doctors, healthcare professionals who can give shots, please sign up and help us out, volunteer. We're getting a lot of help from our fire department, our EMS, EMT folks, getting a lot of help there. We're working with a lot of nursing schools, WashU, some folks from Webster, St. Louis University. So we do, but they've been helping us for 16 days now, so we could really use your help if you can volunteer a little bit of time. All right. Oh, let me mention one other thing. So we have about 55,000 people on our sign-up list in the city of St. Louis. Those are city residents on our sign-up list. One of the things that we know is that 40,000 people, let me get the exact number. Almost 42,000 people in the city of St. Louis have already gotten at least one shot. So if you were one of the people who signed up on our list, it's likely that you've already gotten a shot, because 42,000 people have. Of those 42,000 people, about half of them have also already gotten their second shot. So if you still want to get the vaccine, please register on our list and we will get to you. I know that anecdotally, I talked to a couple of people this past week who had said to me a week ago, well, why haven't I gotten an invitation? And then they got an invitation, they got the vaccination, and now they've gotten 3 or 4 invitations. So I think that is one of the things that's happening which is perhaps the reason that we may still have some openings for this Saturday and Sunday. But check your email. And I think that's all I have for today. Do we have any questions?
A couple questions. So first up, where did it go? Barbara's question had to do with, you mentioned that the COVID-19 numbers in St. Louis were ticking up a little bit.
Mm-hmm.
Is it being driven from one particular place, such as more parties, workplaces, or schools?
Well, we know that Washington University just came out with a study this morning, I think it was, that says it is not being driven in schools. I think it's just being driven mostly by life. You know, people are out and about. There is some variants. We know that some of the UK variant, which is B117, there's a bit of that we've heard. But I don't think there is one thing that is that's ticking the numbers up. But you know yourself perhaps, and maybe some of your friends and family might be just easing up a little bit, and we just all have to continue to be vigilant. People are starting to travel. Our airport yesterday had about 65% of what a high day would be. So more people are traveling, more people are flying, more people are going out. So just, be vigilant.
Sheena's question is Missouri's vaccination tier system fully open now?
Sheena, it's not. Thanks for asking that question, because I meant to go over that and I didn't. So right now, phase 1B, tier 3 is open. And tier 3 includes teachers, child care workers, energy workers, computer folks, government workers in tier 3. That opened this past Monday, so on the 15th. In 2 weeks, well, a week from this coming Monday, on the 29th, Missouri goes to phase 2. And so that will include commercial people, manufacturing, construction, defense. That's a whole nother tier. And then 2 weeks after that, not even 2 weeks, after that, on April the 9th, I believe is the date, it's fully open. So we're very close to being fully open at this point. We are still really concerned about anybody who's over 65 that hasn't had the opportunity to get the vaccine, or anybody who's an adult under 65 with an underlying health condition. So we have really been focusing on those folks. We've worked with a lot of senior centers, a lot of senior homes, Casa de Salud, a lot of our immigrant population. So we are still concerned that there are people out there over 65 or who have underlying health conditions that have not had the opportunity yet. But it is opened up considerably this past Monday. And in another week, it'll open more. It'll go to phase 2, which is a lot of people, and then 10 days or so after that, it will be everybody. So we know more vaccine is coming, and that's why I circle back to say, if you have the ability to help, to volunteer, to work an event, or to give shots, we would really love to have your help.
Question from Christopher about the high-risk categories. How close is the city to completing vaccinations on the most high-risk categories?
Well, there are 40,000 people in the city who have received at least one vaccination. There are over 40,000 people who are over 65. And then there are a number of other people in the neighborhood of 75,000 people, this is an estimate, who may have an underlying health condition. So what you have here is a big population of people that are eligible. We're saying probably half or 60% of those people are willing to get the vaccine. So of those people, 40,000 have been vaccinated in the city. It's a little bit of a number that's hard to pin down. But more and more people, even people that were hesitant initially to get the vaccination, they've seen a lot of their friends and their family and their neighbors be vaccinated and not have any adverse effects. And so fortunately, some people are reconsidering that decision. We've seen that in our own workforce, that maybe people when they were first eligible, they didn't take it, but now they're like, well, okay, I'm comfortable now. So people will make their own decisions about that, but of course we are encouraging everybody to get vaccinated.
We did get a question, Mayor, from Ian about the American Rescue Plan and your framework.
Mm-hmm.
Curious on the public safety front, how much of what you're proposing in the $78.5 million is looking to go toward demolition? How much could possibly be invested for grants or zero interest loans to save some at-risk structures?
So, of course, I didn't bring that over here, but I can remember most of these numbers. Under the public safety category, there's a considerable amount of money, I believe it's $4 million a year over the next 3 to 4 years, that we're recommending, and you can see this if you just look at the plan, there's a schedule there, that we're recommending be for what we call Prop NS. And Prop NS, it's Proposition Neighborhood Stabilization. It's something the people of St. Louis voted for about 4 years ago. And it is a program where you take an LRA property that's not in terrible shape, but that probably needs a roof or maybe needs gutters or some tuck pointing. And you spend the money to make that property stable and watertight, because water is a huge, it can erode a building in a very short period of time. So we are recommending at least $4 million a year to be spent in addition to the regular Prop NS funds, which are about $6 million a year, in order to stabilize those properties. When those properties are stabilized, then we're recommending, and this would happen, that those properties be sold to someone who can finish the property. There's probably a lot that needs to be done, but once you get a roof on it, tuck pointed, maybe some gutters, then it's a lot more doable project for an individual or a small contractor to be able to finish that building. So that's one thing. The second thing is removal of any buildings that are way too far gone to be renovated. And there are quite a number, although we have removed over the last 4 years quite a few of them. But if a building is really, the back is off, the side is off, and it's got no roof, probably that's a building that is a candidate to be removed. So there's money in there for that as well. I've kind of forgotten the rest of the question, but those are two big things that have to do with preserving, stabilizing our built environment, repopulating our neighborhoods, and removing any buildings that are really a danger, a public safety risk to neighbors.
That's it for questions today, Mayor.
That's all for questions. Thank you all. Appreciate you being here this afternoon. Have a great weekend. Sign up for your appointment if you still want a vaccination. And appreciate talking with you, and we'll be back to talk with you next week.